All right, let's dive into something pretty interesting today.
Okay.
You've sent us a bunch of research on funding for global health initiatives,
Mm.
specifically focusing on something called, and I'm going to quote this here, innovative financing instruments.
Oh,
Now,
I like
I
that.
don't know about you,
Yeah.
but that name alone,
Yeah.
that name alone has got me.
It's very
Let-
buzzwordy.
Yeah, it
Yeah.
is. It is a very timely area.
It sounds like we're about to uncover
Mhm.
some seriously creative solutions here.
It is, especially with traditional development assistance for health kind of plateauing in recent years.
Yeah.
We've got to think outside the box when it comes to funding.
For sure.
And understanding these new instruments is absolutely critical
Yeah.
to the future of global health.
So let's break it down for our listener.
Yeah.
What exactly are these innovative financing instruments?
Think of it as a toolbox
Okay.
of financial mechanisms
Good.
designed to generate new funding streams for global health.
It goes beyond just relying on government aid
Mm-hmm.
and leverages creative approaches to raise money
Yeah.
for crucial health programs,
Okay.
especially in low and middle income countries.
Okay, and this research you sent over focuses on 10 specific instruments used between 2002 and 2015.
Yes.
That's a period when global health funding was undergoing some major shifts.
Uh-huh.
What kind of impact did these instruments have during those years?
Well, get this. Just those 10 instruments mobilized almost $9 billion.
$9 billion.
Yes.
That's not just a drop in the bucket.
No.
It's a whole wave. Where did all that money go?
Yeah, a large portion flowed through major organizations
Okay.
like GAVI, the Global Fund, and UNITAID.
Hmm.
They primarily targeted big-name infectious diseases
Okay.
like HIV/AIDS,
Hmm.
malaria,
Yeah,
tuberculosis,
makes sense.
and of course the development and distribution of vaccines.
Right, considering those are some of the biggest global health challenges we face.
Exactly.
But something in this research really jumped out at me. It seems like almost none of this funding went towards non-communicable diseases,
You're right.
like cancer or heart disease.
Yeah.
And those conditions are
Huge gap.
becoming increasingly problematic,
Yes.
especially in the same low and middle income countries
It is.
we're talking about.
The study authors actually point to this as a significant concern,
Okay,
and they are calling for more attention
got it.
and innovative financing solutions to address that funding gap
Yeah,
for non-communicable diseases.
it's like we're focusing all of our efforts on putting out one fire
Yeah.
while another one is starting to smolder nearby.
Yeah, it's a good analogy.
Right.
It's a tricky situation,
Yeah.
especially given limited resources.
So let's get specific.
Okay.
What do these innovative financing instruments actually look like
Okay.
in action?
Let me give you a few examples.
Okay.
One intriguing one is the International Finance Facility for Immunization, or ITFM.
Okay.
It issues bonds, sometimes called vaccine bonds.
Vaccine bonds. Yes.
Tell me more. To raise capital for vaccination programs.
So how does that even work?
Let's say a government wants to launch a large-scale vaccination program,
Mm-hmm.
but they don't have all the funds immediately available.
Right.
The IFM steps in, allowing them to issue bonds on the international capital market.
Okay.
Essentially, they're borrowing money from investors who believe in the long-term social and economic benefits of a healthy population.
So it's like crowdfunding for vaccines, but on a global scale.
Exactly.
Wow.
It's a powerful way to leverage global capital for a crucial public health goal.
That's really cool. Okay, so you mentioned another instrument earlier, the Advanced Market Commitments Pilot, or AMC.
Yeah.
It seems like this one directly tackles the issue of getting pharmaceutical companies to invest in developing new vaccines.
Yes, it does.
Yeah.
The AMC is a unique approach where donor countries essentially create a guaranteed market for a future vaccine.
Okay.
They promise to purchase a certain quantity at a predetermined price once it's developed and approved.
Mm.
This gives companies a strong incentive to invest in research and development, especially for diseases that predominantly affect lower-income countries, where market forces alone might not justify that investment.
It's like saying, hey, if you come up with a vaccine for this neglected disease, we'll be your first customer.
Exactly.
What a great way to motivate innovation.
Is.
What are some other examples of these instruments?
Well, there's one that our listener might be familiar with, Product C, Ed.
Okay.
You've probably seen those special edition red iPods or iPhones.
I have, yeah.
They partner with companies like Apple to generate funds through those sales.
Yeah.
A portion goes directly towards fighting diseases like AIDS.
Oh, I see.
Yeah.
That's a really smart way to leverage consumer power for good.
Mm.
But there's another initiative mentioned in this research that I have to admit I wasn't aware of.
Okay.
The Airline Solidarity Levy.
Yes,
Sounds simple,
it is.
but it's been surprisingly effective.
Yes.
Tell us about that one.
It's actually quite ingenious.
Uh,
It's a small levy added to airline tickets,
Okay.
and the funds go to Unitaid.
So every time someone books a flight, they're contributing, even if it's just a small amount, to global health initiatives.
Precisely.
That's pretty cool.
Most people probably don't even notice the extra couple of dollars on their ticket, but collectively it generates a substantial amount of funding.
Yeah.
It just goes to show that even small contributions can make a big difference when they're harnessed effectively.
So we've got bonds, market commitments, consumer products, travel levies.
Mhm.
It's incredible how diverse these approaches are.
Absolutely.
It seems like these innovative financing instruments really are pushing the boundaries of traditional aid and development models.
They absolutely are.
They offer a new way to bridge the gap
Yes,
between private sector interests and global public health needs.
they do.
But all this innovation doesn't come without some potential downsides, right?
There are some valid concerns.
The research you sent does highlight some risks associated with these instruments.
Yes. One of the main worries is the potential for these instruments to crowd out other crucial funding sources,
Okay.
like domestic health spending within countries.
I see.
There's also the issue of relying on market-based mechanisms,
Right.
which can lead to some unpredictability in funding streams,
Yeah.
making it tough for countries to plan long-term health strategies.
So it's a bit of a balancing act.
It is.
We need to make sure these innovative approaches complement and strengthen existing systems, not disrupt or replace them entirely.
Exactly. It's about using the right tool for the right job
Yeah.
and being mindful of the potential unintended consequences.
Right.
We've still got a lot to learn about how to maximize the benefits of these instruments while minimizing the risks.
It sounds like this is just the tip of the iceberg.
It is.
We've unpacked the what and the how
Yeah.
of these innovative financing instruments,
Yeah.
but there's so much more to explore.
Yes.
The impact, the challenges,
Huh.
the future of global health funding. We'll delve into all that and more
All right.
right after this.
Before we jump into the potential downsides,
Okay?
let's zoom in on a few of those success stories.
Okay.
We were talking about the IFM and those
Yeah.
vaccine bonds.
Vaccine bonds.
It sounds like something out of a sci-fi movie,
Yeah.
but it's actually a really clever way to front-load funding for countries that need it most.
Yeah, that concept really caught my attention.
Okay.
Can you walk us through how it worked in a real-world scenario?
Take Brazil, for instance.
Okay.
Back in 2006,
Mhm.
they wanted to roll out a massive immunization program
Okay.
to protect kids against diseases like measles, mumps, and rubella.
Mm-hmm.
But facing budget constraints,
Yeah.
they turned to the IFM.
Okay.
By issuing these bonds,
Yeah.
they were able to raise over $3 billion,
$3 billion. That's incredible.
allowing them to fully fund that program
Wow.
and protect millions of children.
It sounds like the IFM really came through for Brazil
It did.
in a big way. But what about the investors?
Yeah.
What's in it for them?
It's not just about the financial returns.
Okay.
Many investors are motivated by the social impact.
Mm-hmm.
They see it as an opportunity to align their investments with their values
I see.
and contribute to a worthy cause.
Yeah.
It's about doing well by doing good
Yeah.
and knowing that their money is making a tangible difference in the world.
It's like investing with a heart.
It is.
But does that approach generate enough funding
Yeah,
to make a real dent in these global health challenges?
it can, especially when you consider the long-term economic benefits
Okay.
of a healthier population.
Great.
When people are healthy,
Mm-hmm.
they're more productive,
Yeah.
which ultimately contributes to economic growth and prosperity,
Right.
creating kind of a positive feedback loop.
Yeah, it's like investing in human potential.
It is.
And the returns extend far beyond just the financial. Okay, so we've got the IFM, which seems to be more about immediate funding needs.
Uh-huh.
What about the AMC?
Yeah.
That one sounds more focused on long-term innovation and development.
You're right.
Yeah.
The AMC tackles a different challenge,
Yeah.
incentivizing the development of new vaccines
Right.
for diseases that might otherwise be neglected.
Can you give us a concrete example of a vaccine developed thanks to the AMC?
Absolutely. One of the most successful examples is the pneumococcal vaccine.
Okay.
Pneumococcal disease is a leading cause of pneumonia, sepsis, and meningitis,
Oh, wow.
particularly in young children.
Okay.
But the market for a vaccine in developing countries
Yeah.
wasn't considered profitable enough.
I can see where that would be a problem.
to attract major investment.
Right.
So in 2007,
Okay.
a group of donor countries pledged $1.5 billion to create an AMC for a pneumococcal vaccine.
Wow.
This commitment provided the necessary incentive for pharmaceutical companies to invest in research and development. And within a few years, a new vaccine was developed
Okay.
and made available at an affordable price
Got it.
to countries in need.
So the AMC actually paved the way
Yeah.
for a life-saving vaccine to reach children
It did.
who needed it most.
Exactly.
That's amazing.
And since then, millions of children have been vaccinated,
Wow.
saving countless lives and preventing needless suffering.
That's a powerful example of how innovative financing can spark innovation
It is.
and create solutions that have a lasting impact
Yeah.
on global health.
It does.
Oh, these examples are really inspiring. It's incredible to see how these instruments
Yeah.
are making a difference.
Mm-hmm.
Now, let's switch gears and talk about a more familiar initiative,
Okay.
product, CD.
Okay.
I have to admit, I've bought a few of those red products over the years.
Yeah.
It's a brilliant marketing strategy,
It is.
but is it really effective in raising funds?
It's been incredibly successful.
Okay.
Since its launch in 2006. Product, Red, has generated over $700 million for the Global Fund to fight AIDS, tuberculosis, and malaria.
700 million.
Yes.
I had no idea it was that much.
It's a lot.
I guess all those red iPods and iPhones really add up.
They do?
And it's not just about the money.
Right.
It's also about raising awareness.
It is.
Every time someone sees that red logo,
Yeah.
it's a reminder of the fight against these diseases and the role we can all play in supporting it.
It is.
It's almost like a subtle nudge towards conscious consumerism.
Yes.
You're buying a product you want,
Yeah.
and at the same time, you're contributing to a worthy cause.
Exactly.
It makes you wonder if that model could be replicated in other industries. Could we have green products to support environmental causes?
Maybe.
Or BLUE products for clean water initiatives?
Yeah.
The possibilities seem endless.
Now you're thinking like an innovator.
Right.
That's exactly the kind of creative thinking we need to explore.
Yeah.
There's so much potential to leverage consumer power for good.
Okay, let's talk about the Airline Solidarity Levy.
Okay.
This one seems almost too good to be true.
Right.
A small levy on airline tickets that generates millions of dollars
Yes.
for global health.
Yes.
Tell me more about how that works.
It's all about tapping into a massive global network.
Okay.
In 2006,
Yeah.
France introduced a small solidarity levy on airline tickets
Okay.
departing from French airports.
Okay.
The funds raised go to Unitaid, an organization that invests in innovative health solutions
Right.
for diseases like HIV/AIDS, tuberculosis, and malaria.
So basically, every time someone takes a flight out of France,
Yeah.
they're contributing a tiny amount
Yeah.
to global health. It's
Yeah.
like those spare change jars at the checkout counter,
Mm-hmm.
but on a global scale.
Precisely.
And it's been incredibly successful
It has.
since its inception.
Yeah.
The Airline Solidarity Levy has raised over 2 billion euros for Unitaid.
A lot of money.
2 billion euros.
Yes.
I am blown away by how something so seemingly small
Can make such a huge difference.
It is pretty amazing.
It really highlights the power of collective action.
Absolutely.
Okay, we've covered a lot of ground here.
Yeah.
And it's clear that these innovative financing instruments
Yes.
are doing some amazing things.
Yes, they are.
But let's not shy away from the potential downsides.
Okay.
We mentioned the risk of crowding out
Yes.
other funding sources.
Yes, that's a very valid concern.
Can you elaborate on that?
Yes, we need to be careful that these new instruments
Okay.
don't inadvertently divert funds away from essential public health services
Yeah.
that rely on traditional funding sources.
It's like trying to bait a house on a shaky foundation. You can have the most innovative design
Yeah.
and the best materials,
Right.
but if that foundation isn't strong,
Yeah.
the whole structure is at risk.
Exactly. We need to make sure
Yeah.
these innovative financing mechanisms are strengthening the overall health system,
Right.
not weakening it.
Yeah. That means ensuring coordination and collaboration between different funding streams
Okay.
and avoiding duplication or competition for resources.
So how do we strike that balance?
It requires careful planning and coordination.
Okay.
We need to involve all stakeholders,
Okay.
governments, donors, implementing organizations and communities in the design and implementation of these mechanisms.
Yeah.
And we need to prioritize transparency and accountability
Right.
to ensure that funds are being used effectively
Yeah.
and for their intended purpose.
It sounds like we need a more holistic approach,
We do.
one that takes into account the interconnectedness of the entire health ecosystem.
Exactly. We need to think beyond silos
Yeah.
and focus on creating a sustainable and resilient health system that benefits everyone.
This deep dive is really challenging my assumptions about global health funding. It's not just about writing checks.
Yep.
It's about finding creative and sustainable solutions
Yes.
that empower communities and drive innovation.
And we're just scratching the surface.
Right.
There's so much potential to unlock new resources and explore innovative approaches
Yeah.
that can transform global health for the better.
Well, I'm eager to keep exploring.
Okay.
We've seen how these innovative financing instruments work in practice and the impact they've had.
Yeah.
But what about the bigger picture?
Okay.
What does the future hold for global health funding? We'll delve into those questions right after this. So we've seen the impact of these innovative financing instruments, really impressive stuff.
Yeah.
From vaccine bonds to airline levies,
Like,
they're generating billions of dollars and driving real progress.
they are.
But as we look to the future of global health funding,
Yeah.
are these instruments just a temporary fix? Or are they the start of something bigger, a more fundamental shift in how we approach this challenge?
I think they represent a real shift in thinking.
Oh.
They challenge us to move beyond traditional aid models and explore new ways to leverage existing resources and systems
Yeah.
to generate sustainable funding.
So it's not just about wealthy nations writing checks.
Right.
It's about empowering countries to take ownership
Exactly.
of their own health outcomes.
These instruments can help countries transition from being passive recipients of aid to active participants in shaping their own health destinies.
I like that.
It's about fostering a sense of shared responsibility
Yeah.
and global solidarity.
We've also seen how instruments like the IFSCM and the AMC can actually incentivize innovation, right?
Yes.
Driving the development of new vaccines and health technologies.
Absolutely.
It's like they're not just funding solutions,
Right.
they're actually creating them.
They're acting as catalysts for progress,
Yeah.
accelerating the development of solutions to some of the world's most pressing health challenges.
Right, and that's incredibly exciting.
It is.
But as with any new approach,
Yep.
there are bound to be challenges and areas for improvement.
Yes.
What are some of the key hurdles
Okay.
we need to overcome to ensure that these instruments reach their full potential?
One of the biggest challenges is ensuring these instruments are used strategically and responsibly.
Okay.
We need to be mindful of that potential for crowding out other funding sources
Right.
and make sure they don't create any unintended negative consequences.
It's not just about throwing money at the problem.
Right.
It's about using it wisely and effectively.
It is.
What are some concrete steps we can take to mitigate those risks?
We need to strengthen the monitoring and evaluation frameworks
Okay.
to assess the real-world impact of these instruments.
Got it.
Are they truly delivering those intended health outcomes?
Yeah.
Are they sustainable in the long term?
Those are important questions.
These are critical questions that need answers.
Right.
We also need greater transparency and accountability
Yeah.
to ensure that funds are being used responsibly and effectively.
Transparency is key.
It is.
We need to be able to track where the money is going, how it's being used,
Yeah,
and what impact it's having.
exactly.
That'll help build trust and confidence in these new financing mechanisms.
It will.
We also talked earlier about how the current focus on infectious diseases
Right.
is leaving a significant gap in funding
Yes.
for non-communicable diseases,
Uh-huh.
which are on the rise globally.
That's a pressing issue that needs urgent attention.
Yeah.
We need to find ways to adapt these innovative financing instruments to tackle the growing burden of conditions like cancer, heart disease, and diabetes.
We can't afford to leave anyone behind.
Right.
These instruments have the potential to transform global health,
They do.
but only if they're used in a way that benefits everyone,
Yes.
regardless of their location or the specific health challenges they face.
I think that's a perfect note to end on.
Yeah.
The landscape of global health financing is constantly evolving.
Mm-hmm.
It's up to all of us to stay engaged,
Yeah.
ask critical questions,
Right.
and advocate for solutions that ensure everyone has access to the healthcare they need.
This has been such an eye-opening deep dive.
Good.
We've learned about the mechanics of these innovative financing instruments,
Wow.
explored real-world examples,
Yeah.
and considered their long-term implications.
Yes.
It's clear that these instruments represent a powerful tool for change,
They do.
but their success ultimately depends on our collective commitment to using them responsibly,
Yes.
strategically, and equitably.
I couldn't agree more.
Well, it's been a pleasure diving into this topic with you.
Likewise.
And to our listener, thank you for sending us this fascinating research.
Yes, thank you.
We hope this deep dive has sparked your curiosity and inspired you to learn more about these innovative ways we can fund a healthier future for all